And now, in commemoration of Universal Health Coverage Day, President Bola Ahmed Tinubu has unveiled the Nigeria Health World Sector Renewal Investment Initiative, stating the allocation of increased funds to the sector in the proposed 2024 budget. He stated that this would provide more accessible and quality healthcare services. The President, at the unveiling and signing of the Health Renewal Compact by federal, state governments and development partners in Abuja, also promised to reduce financial burden in assessing healthcare services. Benedict Uku, who covered the signing ceremony in Abuja, now reports.
With the unveiling of Nigeria's Health Sector Renewal Investment Initiative and signing of the Health Renewal Compact, the federal, state governments and development partners have now committed towards advancing healthcare agenda in Nigeria. President Bola Tinubu, at the unveiling and signing on Tuesday in Abuja, announced a massive effort in 2024 to enhance physical infrastructure, equipment and training of frontline health workers.
By increasing investment in health, Nigeria will be accelerating its human capital accumulation and development, likely to enhance our productivity for current and future generations, yielding potential demographic dividend. That is why in our 2024 budget proposal, we have increased allocation to health and social welfare as key elements for our nation's human capital development. Recognizing the importance of primary health care as the cornerstone of a resilient, integrated healthcare system, my administration is embarking on massive effort from 2024 to refurb physical infrastructure, equipment, and retraining of frontline health workers in collaboration with all the 36 states.
The President says the actions taken will strengthen the healthcare governance both at national and sub-national levels in Nigeria.
Regard to my administration's goal to provide universal health coverage for Nigeria, it's our commitment to reduce the financial burden in accessing healthcare. We must help our people. We are currently revitalizing the Basic Healthcare Provision Fund to better provide access to essential healthcare services under a full implemented National Healthcare Act. They give us the mandate. All we pledged that we will serve them. Now we must deliver.
The Coordinating Minister of Health and Social Welfare, Ali Pate, outlined plans to double the number of fully functional primary health care centers from 8,809 to 17,618 by 2027 across all 36 states and the FCT.
We expect to double the number of fully functional primary health care centers that are receiving the decentralized financing facility for infrastructural upgrades, operational cost, and ensured delivery of high-quality essential PHC package, starting by making the 8,809 facilities fully functional and gradually increasing to 17,000 by 2027 in all the 36 and the FCT, as was directed and signed with you, Mr. President. We are redesigning the Basic Healthcare Provision Fund, which comprises at least 1% of the Consolidated Revenue Fund provided by the NHA, as the foundational basis of the sector-wide approach to do a few things: to ensure more equitable allocation of resources to the poorest and most disadvantaged populations in Nigeria.
Speaking on behalf of the state governors, Chairman Nigeria Governors Forum, the Executive Governor of Kwara State, Governor Abdurrahman Abdulrazak, reaffirmed the dedication of Nigeria's governors to making universal health coverage a reality for all.
They carry our mandate to collaborate closely with the Federal Ministry of Health and ensure that the provisions of this compact are translated into practical and measurable actions. The NGS Secretariat, on the other hand, would provide robust support in tracking and implementing the outcomes of this compact. I reaffirm the commitment of the Governors Forum and remain steadfast in its dedication to make universal health coverage a reality for every Nigerian.
The Director General of the World Health Organization, World Bank and other development partners recognized the initiative as one that would bring about transformative change in the healthcare delivery system.
It's no exaggeration to say that today could be a turning point for Nigeria and indeed for Africa. The scale of your ambition is a model for other countries, and if implemented, it will send a powerful message throughout our continent that universal health coverage is possible. It can be done.
We welcome the commitment to redesign the Basic Healthcare Provision Fund to effectively revitalize primary healthcare. We also welcome the focus on health industrialization to unlock the value chain of the sector and support job creation and sustainable growth.
In a federation like Nigeria, the compact between the federal, the national, and the states, and actually down to the local governments. And we here as international partners are ready to support that, and we want to be part of it, help in what way we can.
The federal government has also announced plans to establish a mechanism for the pooled procurement of critical pharmaceuticals in 2024.